What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, having a great Labor Day weekend so far, if you're in the United States, and of course testing negative for the viruses. It is time now for the Saturday edition of the Virus Update for Saturday, August 30th, 2025. That's right, it's the last Saturday of August. Can you believe it? If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Currently, the United States is in a COVID wave. Currently, the parts of New Zealand, Australia, it's wintertime over there. They're dealing with a lot of different viruses. Do you want to stay informed of what's going on with these viruses? That's what I do here on my channel each and every day. If you want to stay informed, subscribe down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Alrighty, folks, we do have several news stories, some of them being important that we need to get to today. We have some data which includes some surprises from the CDC. Number one, we got back the wastewater data from the CDC. I was surprised with all the things that have happened this week, and the new CDC director being ousted, CDC walking out, this and that. And plus, we had an even bigger surprise. The Nowcast variant page actually updated. So we'll show that to you today, and some data from CJS. Quick note though, bear with me today. Not a great long COVID day. I've been extremely tired today for some reason. I get days like this where it just comes on. One day I'm great, I go out to work, and then the next day it's like I'm paying the price because, well, I decide to do what I need to do today before, and then the next day comes like today, and yeah, I'm just extremely tired. Hence why we're recording so late on a Saturday. All right, let's not waste any more time and get into this, shall we? U.S. COVID-19 levels continue to climb gradually. Data on U.S. COVID-19 activity continue to reflect low but increasing levels of illness. I'm a little confused as to why they're saying low, and you'll see why when we get to the CDC wastewater page in a little bit. The agency said the epidemic trend for the disease is growing in 16 states and likely growing in 14 others, plus in Washington, D.C. Over the past week, test positivity for SARS-CoV-2, the virus that causes COVID-19, rose from 10.2% to 11.2%, with levels as high as 17.9% in the south-central part of the country, Region 6, which includes, and I do have my map next to me, that does include Texas, portions of New Mexico, Oklahoma, Louisiana, and Arkansas. So, yeah, things are not going well in that area, and things aren't really going well in most of the country. Nationally, the wastewater viral activity level for COVID is currently moderate. So again, they're saying it's moderate wastewater, but yet low around the country. And I think the definition of low over the years since the pandemic has started continues to be knocked down. Some things that are being considered low now probably at one time would have been considered moderate or maybe even high when it comes to COVID. All right, moving on now to this. This is something from Dennis the COVID Info Guy. In a 4-year follow-up of 816 COVID patients, not a very big study, but 29% developed long COVID per WHO criteria, World Health Organization. This finding matches higher global prevalence estimates and highlights the enduring burden of post-COVID illness. Let me tell you right now, after 2 COVID infections, I do feel the burden of post-COVID illness. Of course, my first case in 2020 was a suspected case, and then, I had problems for several years. Before leading up to my case from last winter at the holidays, I was doing much better. I wouldn't say I was 100% back to baseline, but I really was a lot better. I was being treated for my asthma. I wasn't having these tired spells as much. Then came another COVID infection, and well, here we are. Some days are good days. Today is a bad day. I did work pretty hard yesterday, so maybe that has something to do with it. I don't know, but I just can't not work. Got to do that. So, yeah, it's really frustrating for us people who deal with long COVID, which is, believe it or not, it's millions of people around the world that deal with long COVID. It's really frustrating how you can have one day where, wow, I feel great, and the next day it's like, here we go, Groundhog Day again. I woke up, and I'm still not feeling refreshed from a night's worth of sleep. It happens. All right, this is kind of important. It's such a controversial subject. I hate I don't like using the word hate, but I really hate talking about the vaccine here on the channel simply because we get comments from both sides. Some that are perfectly fine, others saying, oh, that's the problem. That's why everyone's so sick. That's why this is continuing going on. It just drives me absolutely nuts. But I guess I have to mention this because there are people who are going to want a booster. And honestly, at some point, I'm going to want to get a booster. Yeah, I'm admitting that. If you don't like that, sorry. But, yeah, it's just a mess right now with what's going on. There's no clear picture as to what's going on, as to who's going to get it. We're hearing maybe it's going to be 65 or older, but then we come to this. CVS Pharmacy is changing how you can get it in some states. Yes, read this headline. States where you can get a COVID vaccine at CVS following RFK Jr. changes. COVID-19 vaccine availability at CVS pharmacies. In this dark purple color. Prescription required for specific age groups. And I mean, in that case, you're going to need to see your doctor first. I guess that's okay. Some doctors are going to say you don't need it. Some are going to say you are. I mean, it really comes down to the individual person, such as yourself. Do you feel you want to get a COVID booster? If you don't, that is your personal decision. We know enough at this point that while they may provide you some protection against severe illness, transmission is not stopped from the boosters. Yes, they may help you in the short term, but kind of like a flu shot, over time it wears off. And, well, we saw breakthrough cases even in the Delta wave. So the point is, it really comes down to you. Do you want to get a booster? Do you not want to get a booster? Totally up to you. I'm leaving it at that. I'm not saying anymore. I'm moving on. Just know that every state, it's going to be different. As you can see here, CVS has their own thing. Walgreens has something. Probably your independent pharmacy is going to do something of their own. All right, Department of Health Services. Yeah, this is not good. You know how we play this mathematical game. 1 + 1 = 2. 2 + 2 = 4. Well, we're continuing to do that in the state of Wisconsin. Oconto County, Wisconsin now says they're up to 23 cases of measles already. Yeah, that's not good. That's for one county. I believe it was just a few weeks ago they had none, and now they're up to 23 cases there. Yeah, it's not good. And we also have gained another measles case. One new measles case are being reported in southern Utah, raising statewide total to 14. And I do have to show you this. I believe this is in Ohio. Yes. This was posted in our school illness tracking thread. Already several things there. Hey, it's already getting a lot of attention. And I just only started this thread a few weeks ago, and it's almost up to 1,000 views already. An American high school football game was canceled after 2 of the athletes contracted hand, foot, and mouth disease. Did we not just talk about this a few weeks ago in Northeast Ohio? I think we did. There is a dispute as to how the game should be listed, either as no contest or as a forfeit, which would mean one side would win by default. Yeah, kind of tricky to figure that part out, but yep, here you go again. Hand, foot, and mouth disease. This was canceled at the Akron, Garfield, and Revere High School when the Rams pulled out after 2 players contracted the illness. Yep, it's crazy how many illnesses pop up at this time of year. Hey, if you did not see this week, now mind you, this number is now wrong because we've had new updates as of August 26th, so not including what I just said about Wisconsin and Utah. 1,408 measles cases in the United States. Will we hit 1,500 this year? I'm pretty sure we will. Will we hit 2,000 this year? Can't answer that question, but hey, measles continues to rise here in the United States. All right, moving on now to this. The viral activity levels for COVID-19 in Canada is moderate. Flu A is low. Flu B is low. RSV is low at this time. Let's briefly just take a look at what is going on with the air qualities in the United States. And while we're waiting for that, let's pause and take a hydration break, shall we? Today's drink of choice is water. And believe it or not, if you're dealing with long COVID, water's actually not a bad thing to drink. It can help with headaches. If you don't get enough water in a day, yeah, I guess that could cause you to be tired as well. Alrighty, taking a look at this. The West Coast. West Coast is basically dealing with what the upper Midwest and parts of the Northeast were dealing with, say, a month ago. But I think in some cases here, localized areas are actually worse. Take a look at this. We're seeing a lot of purples popping up. Wildfires are a major issue, and that wildfire smoke is going right up into Canada. Yeah, not good, because the jet stream currently is lifting it to the north, and then there's a dip in the jet stream in the northeast. Heck, it is 3:12 in the afternoon, and it's 77 degrees here where I'm at in the east in Philadelphia. For this time of year, that's actually a couple degrees below average. Some issues going on in the southeast. I honestly don't know if that's the smoke making its way there or if it's something else. I have not investigated that too much to give you an actual answer. In Pinellas County, Florida, we do see a few sick person calls, 1, 2, 3 of them, and just one breathing difficulty call. On Friday in Philadelphia, there were 863 EMS incidents listed. And taking a look at what is going on from Montgomery County, Pennsylvania, right now, we do see there are a few calls, 13 to be exact. It has not been terribly busy today. Let's check with Chester County. A few calls there, but not terribly busy. And you do see EMS standby listed as well, which means basically maybe a sporting event. They're just on call in case something should happen. Taking a look at EMS incidents here in Bucks County, which is just the county to the north of me, we're seeing stroke show up a couple times. Hospital situation in Pennsylvania. We're going to be monitoring a few areas. Unfortunately, we can't monitor this area right here, State College, Pennsylvania. It's probably become, let's see, the third most biggest town in Pennsylvania for the weekend. Why? Well, you may notice we're wearing blue today. It's a Penn State game. No, I didn't go to Penn State. I had several relatives that did, including a grandfather, so I do root for Penn State. Sorry if your team's another team. There's a lot of college football teams in this country. And yes, I will be watching this game after we're done recording today's video. Take a look here at just a couple of hospitals dealing with problems in southeast Pennsylvania. Another area we're going to be watching is the Poconos and just slightly west of there. Busy area this weekend, Labor Day weekend. We'll see if there's any calls there. I'll let you know what I hear in Center County tomorrow. I'm probably going to have dispatch turned on this evening just to hear what's going on there. New Jersey, let's see if there's any problems there today. No, none. All right, moving on. Let's get that Friday update in from New York State and see what's going on there. And you can see here, suddenly, once again, things are starting to go upward a little bit. And you also notice, remember CJS told us that there was, in fact, a correction made to the cases? Well, guess what? They actually implemented that correction. New York State did this into their COVID dashboard. Take a look at that. If you go back to August 12th now, it now shows that, hey, on August 12th, they had 1,044 cases. And you can see here, things did slow off, but now they're starting to go up again, and I think they will for a few weeks. Two big reasons. One, it's Labor Day weekend. Two, back to school. Historically, they do go up a little bit more. Once again, you can see last year, New York State, right after Labor Day. Hey, there was a little boost once again. This year, we're seeing that little boost before Labor Day, so that's a little bit concerning. Taking a look at New York State hospitalizations. No, we want to do the hospitalizations first. Let's refresh this, shall we? We can see they currently have 394 people in the hospital, 36 people in the ICU. We'll probably start the new week, given it's a holiday week, on Wednesday. There will be an update on Tuesday. It'll just close out the previous week. All right, take a look at this. We're just going to look at the national emergency department visits. They continue to rise. They're now over 1.5% being diagnosed for COVID. That's right, people showing up at the hospital for COVID. And let's take a look at the age groups real quickly. Yeah, take a look at this. You can see 0 to 11 years old. All the way up to 3.5% of the emergency department visits for you, and or for that age group. And basically, what I can tell you here is all ages are now rising when it comes to COVID emergency department visits. People diagnosed with COVID. All right, drum roll, please. Take a look at this. We do have an update from the CDC Nowcast page, and you might see it looks a little bit different here. Well, there was kind of a little bit of a overhaul here. This is a little expanded, and to the right looks a lot different. There's a big reason for that. XFG is 78% of the cases. So we don't have this variant soup anymore. But what we do have here is this NW.1. And I do keep a bunch of sticky notes. As you know, I use sticky notes for a whole bunch of things, like XFY variant. I believe there's another one here somewhere. Yeah, anyhow, you get my point. I keep sticky notes of these variants. NW.1 is not one I have in my notes. I will be, in fact, making a note of that because that could be something that we need to watch. So there you go. NW.1, now in my notes. One that I don't know about. It could be one of those dead-end variants where it goes up to 2, 3, 4, 5%, and then something else comes along and that's the end of it. You don't hear about it anymore. There are a few others out there not listed here around the world that we do need to keep an eye on, and I have been hearing about that. There's another version of the XFG. It's XFG point something. I forget what it is. Just read about that today. That may be something we need to keep an eye on. All right. We also have this updated today. Take a look at this. The COVID wastewater levels. Yeah, it's not all that good. Take a look here. It's now listed nationally at moderate, which again I'm questioning. Why did they say it was low? The emergency department visits are going up. The wastewater's going up. I wouldn't say this is low nationwide. And we do see here the West Coast is now into the high category. The South is now into the high category. But we see nationally has slowed off a little bit. We'll have to see. I think it's possible we see a national double peaking. Labor Day weekend and back to school. We could briefly see it go back up again and then eventually drop. I think it's safe to say the South is going to peak soon. And I think it's also safe to say maybe the West Coast is starting to peak. Now you can see there. Though it went up, it slowed off a little bit. It really amazes me that the South is still going up at this point because we take a look at last year at this time and you can see, yeah, last year at this time, the South was already dropping, and I suspect we may see a little bit more of a rise once again in the Northeast. All right, let's take a look at some data from CJS, and that is going to be it for today's video. I don't know if we're going to read all this data from CJS because, take a look here, there is a ton. We may only just do the Thursday numbers. Let's see. All right, starting off with Thursday, Florida, 2,667 new cases and 23 new deaths, including 3 from 2024. New York, 860 new cases. Puerto Rico reports 938 new cases. Now some weekly numbers. Arizona, 3,066 new cases, an increase of 36.33% over last week. 155 CDC reported hospitalizations and 5 deaths reported by the CDC data tracker. Colorado, 261 new positive tests, a test case positivity rate of 12.87%, up from 11.68% last week. 101 CDC reported hospitalizations and 2 deaths reported by the CDC data tracker. Hawaii reports 1,180 new cases, a test case positivity rate of 15.4%, up from 15.1% last week, and 3 deaths reported by the CDC data tracker. Idaho reports 494 emergency department visits and 2 deaths reported by the CDC data tracker. Indiana, 654 new COVID cases, 115 CDC reported hospitalizations, and 3 deaths reported by the CDC data tracker. Kentucky, 1,559 new positive tests and 2 deaths reported by the CDC data tracker. Massachusetts, a net of 6,102 new cases reported since July 3rd. This always takes into account cases removed from prior counts. 157 CDC reported hospitalizations and 8 deaths reported by the CDC data tracker. Minnesota, 736 new cases and 5 new deaths reported. New Jersey, 1,238 new cases, 219 CDC reported hospitalizations, and 5 deaths reported by the CDC data tracker. New Mexico, 764 new cases and 1 death reported by the CDC data tracker. North Carolina, 454 hospital visits for COVID-like illness. The CDC reports 337 COVID-related hospitalizations in North Carolina and 11 deaths reported by the CDC data tracker. Alrighty, that is where we are going to leave you off for today. I think we will continue this tomorrow. Well, obviously, we have to continue these numbers tomorrow. Plus, we will also have the latest wastewater. It's Wastewater Sunday, and anything else I can find. Maybe we'll do a recap. I don't know what news is going to pop up between today and tomorrow. I'm sure there'll be at least a couple things. I'm sorry for not finishing these numbers today, but like I said, I'm just really tired for whatever reason today, so I think this is a good stopping point. If you enjoyed today's video, give it a thumbs up. Hit that subscribe button if you're new down below. Hit that notification bell. Share this video with anyone you know. Links to my Patreon and any other ways you want to support the channel are listed down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for bearing with me during this video today. See you again tomorrow.